up in pharmacology. Today's video I'll be mainly discussing about the adverse effects of glucocorticoids or the side effects of glucocorticoids. So in the professional exams, whether it be MBBS, BDS, nursing, pharmacy, or even in the BHMS, all these professional exams of medical, they frequently ask you about the adverse effects or the side effects of glucocorticoids. So in this video we will be discussing about it. So in the earlier video of mine, I have already discussed about the therapeutic uses of glucocorticoids. So starting with, it can come as a form of a short note. So students, beginning with, so the adverse effects of glucocorticoids can be very easily remembered. Just we look at the sequence. Firstly, there is Cushing's syndrome. Now, under the Cushing syndrome, what do we find is that the patient is going to exhibit a moon face. So, patient is having a moon face is there, the buffalo hump is there. Truncal obesity means there is obesity in the truncal region, that is the trunk of the patient is showing obesity. So truncal obesity is seen. Muscle wasting can be seen. So in the Cushing syndrome, this muscle wasting, thinning of limbs and skin can be seen. And just because the skin has got thinned, so the person who is administered these glucocorticoids, there can be very easily bruising of the skin. So skin bruising, just because the thin has become very thin, so easy bruising can be seen in such a patient. Now, apart from this, the patient may present with purple striae, as well as the patient is more predisposed to acne. Now moving on to the next side effect. So first was the Cushing syndrome. Under Cushing syndrome, we have seen so many things. That is, moon face is there, buffalo hump is there, truncal obesity is there, thinning of skin is there, muscle wasting is there, thinning of limbs is there, easy bruisability is there, acne is there, and purple striae can occur. Now moving on to the next side effect, that the next adverse effect, it is the hyperglycemia. So the patients who are on glucocorticoid therapy, the adverse effect what can be seen, it is that hyperglycemia can be seen in such patients, which can result in diabetes mellitus. Now moving on to the next side effect, that is, do remember students, whenever any kind of a steroid drugs are given, so that is going to cause immune suppression. So once immune suppression is there, the patient is more susceptible to infections. So since because the immune suppression of the patient has taken place, so the patient is having immune suppression is there. Apart from this, the skin thinning is there. Also, the next side effect is osteoporosis. So patients who are on long-term glucocorticoid therapy, they show osteoporosis as well. So the next side effect is the osteoporosis. Number 6. So in number 6, what do we have is avascular necrosis. So avascular necrosis, just because the impairment of blood supply is there, avascular necrosis of the bone is there. So whatever the bones are there, they will show diminished blood supply. So avascular necrosis is seen as a side effect of glucocorticoids, and this avascular necrosis of the bone is due to the restricted blood flow through the capillaries. So this is the next side effect. Apart from this, peptic ulceration. So peptic ulceration is seen as a side effect of glucocorticoids, and in peptic ulcerations, what do we find is this may sometimes occur on prolonged therapy, especially when there is ulcerogenic drugs are co-administered to such patient. So certain ulcerogenic drugs, if they are given to patients, if the patient is on these ulcerogenic drugs such as non-steroidal anti-inflammatory drugs, so NSAIDs, the patient is already on aspirin therapy. So such patients who are side by side given glucocorticoids as well, so such patients, there can occur peptic ulceration in these patients if these drugs are being used concurrently. All right, now moving on to the next side effect of the glucocorticoids is that there is mental disturbance. So glucocorticoids, the adverse effects of this is Another very important side effect is that the patient can have mental disturbance, means a state of euphoria. So euphoric, the patient becomes euphoric, means the patient is extremely happy. Euphoria can occur, psychosis can occur, and there can even occur depression in patients who are given glucocorticoid therapy for a longer period. So even mental disturbances can be seen as an adverse effect. Moving on to the next side effect, it is that cataract and glaucoma. So the glucocorticoids long term use causes the increase in intraocular pressure, and ultimately the patient may present with glaucoma due to raised intraocular pressure. And apart from this, the patient can also exhibit cataract. Moving on to the next side effect, very very important, since glucocorticoids, they are causing immune suppression. So once the immunity is suppressed of the patient, the thinning of blood skin is there. So ultimately these all things, the immunosuppression, the thinning of the skin, easy bruising, ultimately the another side effect what can be seen in glucocorticoids therapy is that the patient may exhibit delayed wound healing. So patient may show delayed wound healing in if it is glucocorticoids are administered for a longer period of time. And last but not the least, the glucocorticoids, if they are administered for a longer period of time, the patient may show the suppression of the hypothalamic pituitary axis, that is the suppression of the hypothalamo pituitary axis. So whatever the hormones, the releasing hormones from the pituitary, the stimulating hormones from the the stimulating hormones from the pituitary and the releasing hormones from the hypothalamus. So ultimately the hypothalamic and the pituitary axis suppression is seen. So the releasing hormones from the hypothalamus, you all might be aware, and under the influence of the releasing hormone, the stimulating hormones are being secreted by the pituitary. So ultimately the hypothalamo pituitary axis suppression is seen in patients who are on long term glucocorticoid therapy. So students and viewers, this was a very short video in about the adverse effects or the side effects of the adrenocorticosteroids or the glucocorticoids. So students, if you like this video, give this video a thumbs up, and those students who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up. Thank you for watching.